as you can see, because the government are proposing legislation that will regulate traditional practitioners in every way except whether their medicines are efficacious or whether they're properly medical trained. So this is really confusing for the public, because it means that if they go to one of these people, they're not going to have their past medical history, they're going to think it's safe when it actually might not be. So we've got these questionnaires to hand out to members of the public, and if they can answer these 4 simple questions, like an apple a day will what, and then they qualify for one of our diplomas in Old Wives' Tales. They can go over to the table here and get a diploma, and even possibly a rosette if they did really well. And hopefully this will highlight the cause and make the government decide that maybe it's not the best idea to bring in these regulations.
Hi, my name's Jamie McLennan. I've been down here as part of the VoYS of Young Scientists School of Old Wives Medicine, and we've been giving out diplomas in Old Wives Medicine today. The reason we're doing this is to highlight new government proposal for registration and regulation of traditional herbal practitioners, these kind of traditional practitioners. They don't have any this doesn't regulate any medical knowledge or whether the things are effective or not, but does give them the air of respectability of a normal medical practitioner. And we basically think if these people are getting the extra regulation, then so should practitioners of Old Wives' Tales. And this is what we're doing.
Great. Okay, so essentially we're here today just to raise awareness in front of the Department of Health about registration of alternative practitioners of medicine. The proposals currently are to register them in basically the same way that medical practitioners are. However, traditional practitioners don't have any medical training whatsoever, so having them on the same scale as this is going to cause a lot of confusion. The reason it's been brought in is because there's concerns about patient safety. However, these things will be currently regulated under health and safety, things like that, and so there's no need to give these people essentially a badge, for which they have to have no additional training, no medical training, without actually having them at the same stage as medical practitioners such as doctors, nurses, etc. So we're here today basically to raise awareness, start our own school in Old Wives Traditional Medicine, which we can hopefully eventually also have registered with the Department of Health, and all our practitioners can then have a nice sign outside their door, even though none of them are necessarily medically qualified.
So Evan, could you tell us a bit about why we're here today and what you're doing?
We're here, although this is obviously a stunt, to make the serious point that you can't allow people who don't practice evidence-based medicine, who practice irrational medicine, to have the imprimatur of professional regulation that will make the public think that they're regulated just as tightly as doctors and nurses. Doctors and nurses, first and foremost, have to practice efficacious medicine. They're not allowed to treat their patients with things that they know not to be more effective than placebo, or even things that they irrationally believe not to be more effective.